All right, hello, my friends. Once again, your humble server, Jorge Briones, with your show, What in the Hell? And today we have a wonderful guest, the wonderful Raymond Estrada with WellMed. Raymond, how are you, sir?
Pretty good. How you doing today?
Awesome. Thank you so much, everybody, to who is looking us live. I'm sorry, it's been a crazy day. Looking us live on the Facebook Live. Arlene, thank you so much for being the girl in the back. Today, we're going to talk about what is the importance to have a good medical provider whenever you have your Medicare plan. Because remember, we at your show, What in the Hell, bring you the information of what is, how to understand, and how to get the benefits that everybody's looking for whenever we have a Medicare Advantage plan. So Raymond, let me pass the mic to you and tell me, who is WellMed?
Well, thank you very much again. Thank you again for having me here. Happy Friday, by the way.
Happy Friday. Yeah, there you go, sir.
So WellMed is a network of physicians that practice a patient-centered care model. Really senior focus. So our primary target are going to be the seniors and Medicare beneficiaries.
But specifically, anybody with a Medicare plan or Medicare traditional, right?
Yes.
Okay.
Currently today, we accept always traditional Medicare, and then our two carrier partners that we participate with.
Which are those two carrier partners?
Those are United Healthcare Medicare Advantage plans and WellCare Medicare
Awesome. So, for those that are looking at the live video, so if you have a Medicare Advantage plan or traditional Medicare and you're not happy with your doctor because, again, your doctor is not, friendly, or your doctor pretty much will give you the time that you're looking at, you guys have the opportunity. Because remember, you don't have to be locked up with a doctor if you're not happy or satisfied with it. You have the opportunity to, if you have one of those two companies, by the way, United Healthcare and WellCare, you have the opportunity to do the transition to that. So tell us about how is that transition whenever you guys have a new patient that is looking to get, the care that they need at one of the clinics, Raymond.
Absolutely, and I'll start off by saying this might sound strange, but not every beneficiary it really is an ideal WellMed patient.
Absolutely.
And what I mean by that is when you come to WellMed, when you are going to get a provider and a system and a whole team that's going to be engaged in your healthcare. So we don't want folks to just come in when they have symptoms or an ailment and get a prescription and send them off. We do a lot more than that. We engage in your healthcare. We put together a prevention and wellness plan, which is very, very important. And when you come in, obviously we're going to treat the ailment.
Yeah.
But we also take the time, the doctor takes the time, the motto allows the doctor to take the time to really get to know the patient, really get to understand the patient, and maybe discover any underlying factors of healthcare, like mental health issues or any type of economic barriers or anything like that. And then, in addition to that, we have systems and programs that help overcome those barriers. The last thing that we want to do is have some sort of barrier that prevents a patient from getting the health care that they need.
So let me understand something, Raymond, because that is very important information for everybody that is on the Facebook Live, especially whenever we share this information on all our social media platforms. So let's rephrase what you just said. So, for example, you don't have to be, with all respect, sick in order to find another doctor. You guys will take care of every single detail whenever the first visit is, so they can prevent to get sick and prevent to have, days in the hospital or probably getting something worse, right?
Yes.
Okay. So tell us a little bit more about that care model.
And you're absolutely right. You don't have to be sick.
Okay.
Being healthy, living a healthier and happier lifestyle is really a lifelong battle.
Okay.
Even healthy people need to make sure that they live a lifelong battle with that prevention and wellness. If I can, a couple of stats that are really, really telling about prevention and wellness. I don't want to get too much in the weeds.
Yes.
But a couple of stats that really hit home to me, and this is from the CDC and other reputable sources. 80% of the chronic illnesses like heart disease, stroke, type 2 diabetes, even cancer, 80% of those type of illnesses and diseases can be prevented if somebody is following along with a wellness and prevention program.
A prevention program.
Now, we realize that illnesses and diseases are going to happen. You can have the best ran program best wellness and prevention program, you're still going to have the illnesses and diseases. It's a fact of life. However, I think a stat that really hits home to me is of those illnesses and chronic diseases that happen, if the beneficiary was on a prevention and wellness plan, they can eliminate up to 40% of possible death.
Wow.
So if you combine death, which is worst case scenario, what we're all trying to prevent,
yes,
along with the 80% of outright elimination, that really shows how important wellness and prevention is. And so I think any care model that you're looking at really should start with that. And when I talk about prevention and wellness, we're talking about your regular routine exams. Make sure you're getting your mammograms and make sure you're getting your flu shots and make sure you're doing all your follow-up care. That's what WellMed offers. We offer that. We engage with each and every individual to make sure that we work with them so that they are staying healthy and following those prevention and wellness plans.
And I assume that you guys also encourage the famous annual wellness exam that everybody have with their Medicare plan, right?
Absolutely. It starts with that.
Okay.
Yes.
So remember, if you guys are listening, this is the second quarter of the year already. If you enroll in a Medicare Advantage plan last year to start January the 1st and you have not gone to your doctor to get your wellness exam, remember, that is an option. That is a feature that most Medicare Advantage plans have available for you. And if you have not scheduled that, hey, call your doctor. Set a time a day that you guys can get that taken care of. But also remember, if you're not happy with your doctor, if you're not satisfied with the care that they're giving to you, you have the freedom of choices and you have the freedom to say, hey, I want to try these guys. And one thing that I can say as a point of view as an agent, okay, remember, JWB is a group of agents here in Houston that we serve the senior community with any type of Medicare plan, Medicare supplement plans. One of our mottos is, again, to help every single body to understand what is available for them in their Medicare plan, right? What is, for example, the options or the best alternative for diabetic people, for heart condition people, and just for those basically that are healthy and they don't have a major use for the Medicare plan, but they still want to have a good care. These alternatives are available, and the clinics for WellMed pretty much are going to make sure that you guys understand how important it is to use these benefits. So, Raymond, WellMed is a clinic, a series of clinics, a network of doctors. Right. Tell us about that.
We are a network of physicians. However, we operate in clinics.
Clinics.
So we have 19 owned clinics today in the Houston area.
19 clinics?
19 clinics.
Wow.
Across and surrounding Houston. What I'm most proud about is we also have many clinics that are in the underserved populations and underserved areas. And so I'm really proud about that. We will have probably another 3 to 5 that will open up by the end of the second quarter, by the end of June, and hopefully more by the end of the year.
So we're looking at possibly end the year with 20 plus clinics in the Houston area.
That is correct, yes.
So if you that are having, issues again, every single body that is listening to the podcast, if you're looking to have an alternative to have a new doctor per se, check these guys out, give us a call. Let us the opportunity to help you with, locating another doctor, maybe a clinic nearby you guys, because I assume that you guys are all over Houston, right?
That is correct, yes.
So like, for example, if you don't know where is the closest location, hey, give us a call. 281-743-8691. Remember, our agents are always ready to help you guys. We're more than happy just to give you that information and to give you that, details of what doctors are available. And Raymond, because we serve a multicultural community here in Houston, are your doctors speak Spanish?
Yes, most of our clinics, we have both physicians and providers that speak Spanish, as well as staff, as well as a couple that speak other languages.
Other languages.
Yes.
So if you're thinking that you need to have a doctor speak your own language, maybe WellMed Clinics will be an option for you. And also the most important thing is that maybe your insurance, okay, it is already available for you guys to start getting services at the clinics. So if you want to know more about the services that WellMed provide, please give us a call, 281-743-8691. So Raymond, tell us a little bit about the story about WellMed. Where did WellMed come from?
Very good question. And really, even though we're a little bit newer in the Houston market, we've been in the market a couple of years, By no means is WellMed new. In fact, we are one of the pioneers of this healthcare model. Dr. George Rapier started WellMed in 1990 in the San Antonio area.
Okay.
He had a couple of clinics down there, and one day he decided he was not happy with the traditional fee-for-service Medicare model where he sees patients, treats their ailments, and sends them on. He was seeing many patients that day. He decided one day, and as simple as it sounds, it really is what it comes down to. He decided he was going to back off of that fee-for-service model. He was going to start treating each patient individually, expand his visit time so he can get to know the patients, and then put in wellness and prevention plans. And very quickly, from those 2 clinics, he had to add another because it became so popular, and another,
wow.
and another, and then it expanded to really all of Texas, Florida, and New Mexico. And
wow.
And so we've been practicing this model since 1990, so over 30 years that it's been around.
So, guys, one more alternative available here in the Houston metro area for anybody that is looking to have a new provider or maybe pretty much wanted to see another alternative. Because remember, at the end of the day, you know, like I always said on previous shows, you know, not every Medicare plan is good for everybody. You know, let us have that opportunity to see if what you have is the right option for you, if what you have is the correct plan that will save you money at the end of the day for your medications, for your diabetic supplies, for your meals. You know, there's so many things available nowadays that you guys can have with your current Medicare Advantage plan. So, you know, it is one of the most important things to be aware of, you know, the prevention, like you just mentioned. Prevention. You know, you don't have to wait until the last minute to say, hey, you know, now I don't have any alternative to maybe get a better plan or maybe having a doctor that understands me. You know, don't hesitate to give us a call because there's still options available. Even though if you don't want to change your plan, maybe let us see if what you have available now will allow you to go to the clinics. Because no matter that you don't have a plan that is good for the clinic, maybe your plan that you currently have, like United Healthcare or WellCare, will be allowing you to go to see this model. So Raymond, we're running a little bit of time, but let me just ask one more thing to the whole show. What would you say is the most distinguished part of the WellMed model for anybody that is listening to us through the Facebook Live, the ones that will listen to us on the Spotify, the ones that probably get that little video that comes in your ads whenever you're looking at the videos on Facebook or Instagram? What would you think it will be the most important thing that WellCare will offer to their patients?
You know, there are quite a bit of things, but I think the most important thing really is the personal touch and the connection that the providers are allowed to make with that person. Again, I can't state it enough to where each doctor, each physician at WellMed treats each patient individually and not just for the ailment. They try to really understand and get to know their patients. And so I think the biggest thing that we offer is that engagement, that partnership to live a healthier and happier lifestyle. And we want to be your partners for life.
Yeah.
And so I think that's the biggest thing. You know, I can go on and on. There are services
Absolutely.
that we offer, programs that we offer to eliminate barriers, but really that personal touch, that provider that is going to engage with you and not just write you a prescription and send you off, that is what we're all about.
One of the things that I like about Raymond Clinics, in my personal opinion as an agent, you know, I actually have that experience to refer members to the clinics, is that, you know, they are very attentive and they don't wait to the members to get in their door to reach out. You know, that is one of the most amazing part whenever we agents face, whenever somebody says, you know what, my doctor is not helping me to get my medications. Maybe my doctor don't want to hear me because I have too much pain and they think I cannot take my pain medication because it's this and that. You know, I want to say at the end of the day, if you guys have a Medicare plan that is right, that is appropriate, and at the same time you have a provider that is going to care for you, that is going to pretty much listen to you and help you getting those benefits, that is what is important at the end of the day. And we want to help you. Remember, JWB, What in the Health, your podcast every week. You know, we are here to help. We are here locals. We are here we want to able to show you what is the best alternative, the closest WellMed Clinic, the closest doctor that speak your language. Let us help you. Let us give us a call, 281-743-8691. We are here. We are local and we speak your language. Raymond, the time is over, but thank you so much again for being here. You know, I'm looking forward to see maybe having you another time, maybe with a different topic that we can bring to the people that are, that listen to us. Thank you so much again, Raymond. Until next time.
Thank you very much.
Thank you, guys.